But today we have Dr. Ayush Khetarpal. He's practicing in Delhi NCR. We're going to be talking about kidney stone management. Very welcome, sir.
Hi.
Well, today the very first thing which comes to my mind is, why do you think the number of cases when it comes to kidney stone is on the highest and the constant rise these days? What could be the reasons?
Mostly, it is a lack of water. In the routine days, we take less amount of water, and we have diets which are rich in auxiliary diets are there. So we should avoid all those things. So that is very important. And the amount of stress everyone is having these days. So this is one of the causes.
Well, one of the most challenging cases, if you could recall, wherein you had a patient with stone, and how did you remove his stone? One of the most challenging cases, if you could recall.
Depends upon the size and the location of the stone. It can be the kidney, it can be in the ureter, it can be in the bladder. So of course, I had a patient once he had a 5 centimeter stone in the kidney. We did a PCNL and we just removed it easily.
Removed it easily. Yeah. Now he's back on track.
He's back on track. You would be surprised to that he was 85 years of age.
Oh, wonderful, wonderful.
Yeah.
Okay, so when we were talking about kidney and stone, of course, there are chances that if a person already had a stone and now he's free of it, there are chances that he might that stone might reoccur. Now, what a patient can do in order to avoid that and prevent that reoccurrence?
The patient has to follow the renal stone diet chart. Of course, he has to take a plenty amount of fluids, at least 2.5 to 3 liters of water in the day. That is, I would say, in 24 hours.
Okay.
And he has to avoid the auxiliary diet. Some patients who are very keen on having, who are on protein-rich diets, we ask them to avoid the protein-rich diet, and all those other things are there. So.
Do we need to restrict the protein diet? I mean, no, we won't take, or we can take it in a moderate form.
You have to take it in a moderate form. Sometimes people are more like you have to cut on basically on the non-veg. I would say the animal protein, which has to be cut down.
When it comes to kidney stones, we also have a lot of myths and misconceptions. So, if you would like to break any of them.
Some people say that yes, drinking alcohol or drinking beer, the most important thing. I mean, it's like it's a myth which everyone says कि beer पियोगे तो stone निकल जाएगा, which is actually not true. The amount of beer, it has alcohol, and it is basically a carbonated water. So you can simply drink a lot of water, which I've told you earlier, that you can drink a lot of water and it can easily remove the stone. Depending upon the size and the stone of the size and the stone. So we can easily remove the stone, even with the help of a conservative management.
When I'd like to know the very last question, actually, what do you think the next major breakthrough in kidney stone domain could be?
Nowadays, we are doing. We are not giving any. We would say we are doing scarless surgeries. So like we are doing RERS. RERS is something where we do the surgery without putting in any. Without putting any incision. Any sutures in the body, so you can easily go inside. You can, with the help of a flexible scope, wherever the stone may be, we can remove with the help of the laser. That is very easy.
Yes, that is actually. So with this, we are ending this interview, and thank you so much for being here.
Thank you so much.
We are very glad to have you with us.
Thank you, ma'am.